So Chris Jones, Chief Executive, BMJ Publishing Group. So the growth and development that is happening in artificial intelligence today is going to have a significant impact on healthcare for a number of reasons. Firstly, there is the overall reduction in costs that are associated now with the development of AI tools and technologies, the significant expansion in data that is being generated as a consequence of healthcare, whether that is health records, whether that's a consequence of clinical studies, whether that is a consequence of the development of more information around genetics and genome sequencing. But also the fact that we're now seeing a far greater development of the algorithms that can be deployed against content. So those things alone suggest that artificial intelligence in healthcare is going to grow. The prediction in terms of spend is significant. The latest research from Statista suggests that the spend in artificial intelligence is going to reach something approaching 190 billion by 2030. And there are three reasons, I think, for why that is going to happen. AI will inevitably enhance the quality of medical provision. It will help reduce costs for all concerned in the context of healthcare provision. And it will increase accessibility for all in the context of how easily they can access high quality support, whether that is in a rural setting or whether that is in a setting within a city or greater suburb. So some of the areas that we're already seeing the development and utilization of artificial intelligence in healthcare is virtual nursing assistants, the growth of telemedicine, and that's very specific in generally all communities and all countries, but I think it's particularly relevant here when we think about India. I think there's sort of recent research suggests that per 1 million of population, there's around about an average of 64 doctors in India, compared to about 150 in the global average. And one of the benefits I think that artificial intelligence will bring is that it will support telemedicine, delivering high quality access to healthcare at scale. I think that's incredibly important, globally, but I can clearly see the application here in India. We're also seeing it being deployed specifically in reducing dosage errors. We're also seeing it in some contexts to reduce fraud, particularly around insurance claims associated to healthcare. And there is inevitably the benefit that it will bring through in terms of administrative workflow, creating more efficiency in the healthcare system. And I think when we think of the burden often placed on doctors and clinical professionals in administration, if we can reduce that, creating more time, more space for them to actually be with their patients, supporting and delivering high quality healthcare, there is a real benefit in terms of the efficiency that hospitals and hospital trusts can benefit from. But of course, we're also seeing it in medical imaging, being able to process images more quickly, getting higher quality diagnosis off the back of those images. And we're also seeing it in terms of creating better treatment plans as well. And that is one area that BMJ specifically is focusing on, is supporting doctors at the point of care with better diagnosis and better treatment plans through developing our content for use in artificial intelligence environments. So BMJ is an organization that is now 180 years old. So we have a very rich heritage and a very trusted brand. And we're most closely associated to providing high quality healthcare medical information to clinical professionals across the globe. And that is there to support them both in terms of their academic research associated to healthcare development, but also in the practice and the delivery of high quality healthcare. We do that through publishing high quality journals that present the best in class research that is being undertaken in healthcare and medical science today. We provide continued professional development for doctors and clinicians, and we also support them at the point of care with diagnosis and treatment recommendations as well. And we do that globally. Now, whilst the business is headquartered in England, we also operate in the US and China, and specifically here in India as well. And one of the most important aspects of what we do is recognize that whilst healthcare is in many respects global, and the issues that healthcare systems face are often very much the same. The important thing is that we create and support our clients and customers here in India with country-specific solutions. And that is very particular in the context of continued professional development. So the demand to upskill and reskill and to ensure that doctors and clinicians are really at the forefront of their knowledge requires us to think very carefully about how we take content and make it relevant to the local market. So content in context, learning in context, making it relevant to the marketplace here in India. And we're also looking very closely at how we do that with our publishing program as well. So ensuring that we're creating opportunities for best-in-class academic and medical and healthcare-related research to be published here in India, but most importantly to represent the authors and researchers and all the outstanding work they're doing here in India to be published and recognized in India here too. So specifically in the context of India, one of the things that we are really focusing very hard on is how we ensure one of our clinical decision support products, Best Practice, can be further developed to support the growth and development of artificial intelligence and specifically its use in healthcare settings. So Best Practice is what I would call a referential database, not dissimilar to perhaps how someone might typically sort of search on Google to find an answer to a question. And Best Practice does that, but very specifically based on highly curated, very structured clinical evidence. And it is quite unique in how it is structured and how it delivers to the clinical professional the very best guidance in terms of diagnosis, treatment, and next best actions. The opportunity in the context of healthcare and through artificial intelligence is to make that very much more active. So instead of a clinician having to ask the question, the benefit that Best Practice will provide is it's supporting the clinician as they're going through their point of care consultation. And we fundamentally believe that that is going to improve the quality, it'll help reduce the cost, and it will certainly support better healthcare provision, not only here in India, but specifically across the globe. We are talking to a number of potential partners in how we can do that, and that ranges from those involved in telemedicine, so integrating our content into their applications, supporting the clinician, and at times potentially making some of that content available to the patient themselves to better understand the diagnosis, the treatment, and the best plan in terms of care. But we're also thinking about how we work with other technology providers. So integrating our content into electronic health record systems that may operate in hospitals, working with a range of other clinical providers. So in the US, we're talking to insurance firms that are actually working to underscore and underpin better quality claims-related information. But interestingly here, working closely with some of the hospital groups to see if we can better improve the quality of the care that they ultimately provide. So we're very excited at the opportunities that we have here in India. We're very excited at the opportunities that Best Practice will provide. And we're very excited at the opportunities that AI specifically will bring. Although, like many others, we equally recognize the challenges around ethics and regulatory governance and data privacy. And so we are actively engaging in all three of those to ensure that the way in which AI is deployed is appropriate, it sort of ensures data privacy, it is operating at the highest level of regulatory governance, and it is used in an ethical way to support better treatment and better health outcomes for everyone and not just a few.